readmissions can definitely be a concern not only for the hospital, but obviously for the patient. There's apparently something not being taken care of that's required that patient come back to the emergency department.
There have been many discussions about trying to interface with the patients before they got to the units, because we were finding a lot of patients were getting admitted and they didn't necessarily need to be.
When Susan approached me and said, I'd really like to try this because I think I could get people in the right place before they're readmitted, I said, I think you could.
A lot of those patients, they come back in frequently because they have no outpatient help. And she's able to take the time with the patient, sit down and talk to them to find out what's going on and try to get the patient to the outpatient services that's really needed. And that's a real benefit for the patient because they actually get the problem that they have taken care of.
Sometimes a patient has been in the hospital within the last 30 days and they have been transitioned home. They decided maybe they went home with home health, something like that. They are starting to have some problems. They're not doing well at home. They're not sure what their options are. They come back to the emergency room. I've been able to intercede with them and find community placements for them in skilled facilities so that they can go and get a higher level of rehab, therapies and things.
And that's really what Susan's job was about. Was we didn't really want to focus on as much, this is how much money we'll save, this is what we'll do. It's the right thing for the patient at the time.
The whole purpose of my job is to work for the hospitalist patients. We usually have about 100 patients, between 100 and 125. My job is to get them where they need to be and get them there successfully to make sure when they leave the hospital they have all of the tools they need to be able to stay out of the hospital. Susan in the emergency room and I have a very close relationship. Whenever we have patients that come back in the emergency room, she calls me and says, hey, this patient's back. I saw you just saw them a couple weeks ago, or you just talked to them on the phone last week. What was going on, and this is why they're here. And she and I are able to kind of triage them from the emergency room and figure out why they're back and if there's anything that we can do to prevent them from getting admitted, or what our conversation was with them at home.
And to be able to have that personality to not only go to the high stress doctor who's used to those situations, but slowing it down for the families that are there, and to be able to get those patients, just let's take a breath, get the patient to the right place to begin with, and it's the right thing to do.
With the physicians, it saves them time from having to call all of the doctor's offices, and it makes sure that things that we do here in the hospital are followed up on when the patient leaves here, so that lab tests are followed up on, culture reports are followed up on. We make sure they get on the right antibiotics for things, and that they're getting the care that they need not only here but once they leave.
I think the teamwork and the bridges that it's built within the community has been the biggest thing.
Our community team is called ENACT, which stands for Norman Area Community Transitions Team. The community team started with a care transitions conference that was held, and different providers in the area contacted OFMQ about starting a community team here in Norman.
The community meetings that we're having are vital, and I've been telling a few people in other communities, Oklahoma City, Midwest City, what we're doing here in Norman, and they're already thinking, how do we get involved in this? How do we do this in our community? To bring in an ambulance company, lab companies, long-term care, physicians, all these people in the same room and able to talk about what would be helpful for us to take care of our patients, and when we hand them off to you, how that is helpful in the information you need. It's been a very positive experience, and honestly, I was skeptical that it would be able to work. And just in 3 very quick meetings, I think we've come a long way.
Those providers are already contacting me because they know me now, and we're trying to improve our communication and make sure that that everybody's on board with this, all the other case managers in the hospital, and that we open those lines of communication. It benefits us and the patient. We have the Care Tracker system with the Direct program, and the Direct program communicates electronically between us and the nursing homes. When a patient from Cedar Creek, for example, is getting ready to come to the hospital, the director of nurses will just send me a text that says, get on Direct and look, we've got a patient on the way.
I think that it's really helped to build relationships with a lot of the employees at the hospital. So I think it's really helped to build those relationships, because a lot of times you don't see or talk to those people, and so you don't know what's going on. And by being able to communicate via basically email, it kind of helps to have more of a relationship. They get quicker service. When they do go to the emergency room, the nurses and the doctors know a lot more than they would. They know, okay, this person's coming in. They have all these diagnoses. They have all these symptoms. They basically know some of the things that they're going to do before they even get there.
We've been able to pull that information off of there and print it off and hand it to the physicians, and that information is very well laid out. It's very concise. It's very to the point, and the physicians really appreciate that, because sometimes that gives a different picture than what they've gotten over the phone or what we're hearing from the ambulance driver who picked the patient up.
The benefit has been multifaceted. My clinical documentation has improved greatly, I believe, because the accuracy, the buy-in from the nursing staff, and that's number one. And the resident care and the way that they're able to track and monitor the care that's provided to the residents, and within the same shift check and make sure that the data has been recorded. If not, they can reach out and touch charge nurses and the appropriate staff to make sure things get done in a timely fashion that we would like. That's the vision that we gave the staff, that you're part of the future here. We have a real unique opportunity to build this.
My passion for care transitions is taking care of the patients. The reason I come back to work every day is because I know that I've found a safe plan for my patients and that they're going to be taken care of, and that's what brings me back.